Well, thanks so much for joining me today for the third episode of Season 4 of the Healthy Skeptic MD podcast. I'm Dr. Michael Hockman. I want to again begin today by acknowledging and thanking the Health Plan and SCAN group for their support of the Healthy Skeptic MD podcast. Today we are going to be talking about a health topic that does not get as much attention as maybe it should, and that is loneliness, which, as we will learn today, is actually as big of a risk factor on our health as cigarette smoking. And we're going to talk about how the pandemic has highlighted this and why it's the perfect opportunity to take this health issue head on. My guests are Dr. Julianne Holt-Lunstad from Brigham Young University. She's perhaps the nation's leading academic expert on this topic. I'll also be joined by Miss Lisbeth Briones-Roberts. She is the Chief Togetherness Officer at SCAN Health Plan. And she's going to tell us about the really creative work that she and her team are doing at SCAN to take on loneliness in a systematic way among frail older adults. It's a great episode, so please do stick around to listen to it. If you do find today's episode engaging, please do search and subscribe to the Healthy Skeptic MD wherever it is you listen to podcasts. Search for me on YouTube, Healthy Skeptic MD. Leave a review if you have a chance, and do, of course, pass it along to others who may be interested. So before jumping into today's interview, we'll kick it off with the health news of the week, starting with the pandemic. And the first item I want to touch on is the Delta variant that we've all been hearing quite a bit about in the news. The Delta variant is now responsible for more than 10% of all COVID infections here in the United States. And in fact, there's some pockets of the country where it's more than 30% of infections. As we've all probably heard, the Delta variant is more than twice as readily spread compared to the standard strain. So far, we don't have any evidence that it's any more virulent than the standard strain, but more data is being accumulated on that as we speak. So hopefully that will remain the case as we learn more. The first thing to acknowledge is that although this is certainly something for us to take very seriously, we are much, much better off than the rest of the world here. And the reason for that is that we have such a high rate of vaccination here in the United States. And a British study has found that the Moderna and Pfizer vaccines are more than 90% effective, not only in preventing infections from the Delta strain, but more importantly in preventing serious illness and hospitalizations. Now, a caveat here is we don't yet have data on the J&J vaccine. So that's something to follow closely to make sure that the J&J vaccine is equally effective against the Delta strain. So, simply put, if you've been vaccinated, the Delta variant strain is very low health risk to you as an individual. But I do worry quite a bit about the rest of the world and pockets of the country where there is lower vaccination rates. And in particular, I'm worried about Tokyo right now because 3 weeks from now, they're going to be having the Olympics, and only about 11% of the population there has been vaccinated. So here in Los Angeles, in response to the Delta variant, public health officials have begun recommending that even among those who have previously been vaccinated, in indoor environments where you don't know the vaccination status of others, you consider wearing a mask, which sounds like a step backwards. Now, I do not like criticizing our public health officials. I think they've done a very, very good job in this pandemic making hard decisions on limited data. But on this particular item, I do disagree with them. And the reason is very simple. The vaccine seems to be very, very effective at preventing infections and illness from the Delta variant, and as well as preventing spread of the virus to others. Here in the United States, virtually everyone who wants it has had an opportunity to get vaccinated. And rather than taking a step back with the mask guidelines, I would much rather keep the carrot in place of using it as an incentive to get vaccinated, that if you get vaccinated, you don't need to wear a mask in indoor environments. But we'll see where this policy all shakes out over the coming weeks. So finally, I have a fun study to finish off with today. So we're all familiar with those annoying paper forms that we need to fill out every time we go to the doctor's office. And in my experience, on the back side of things, we don't even look at those forms after they're filled out half the time anyway. So in this study in JAMA Internal Medicine, it found that in a typical primary care community practice, at least 70% of the time, patients receive at least one form that's not necessary. So this is, of course, a huge waste of our time, but more importantly, it can potentially be harmful because it can distract us, take our attention away from more important things that actually do need to happen during these medical visits, including completion of those important screening forms. And maybe part of the reason that we don't read them so often is because we have to sift through so many that are unnecessary. Another reason these unnecessary screening forms can be harmful is that it may lead to wasteful, unnecessary follow-up care that can actually lead to more harm than good. So in an editorial that accompanied the article, they argued that these forms, in many cases, are driven by regulatory requirements and quality monitoring, which of course was intended to do good, but hopefully this study will shed a little light on the problem of too much paperwork and will give a little bit of a relief to those of us who have to sift through it and complete it all the time. So that's it for their news summary for today. And now we will jump into our interview with Dr. Julianne Holt-Lunstad, excuse me, and Miss Lisbeth Briones-Roberts. Thank you both for joining me today.
I'm happy to be here.
Yeah, happy to be here.
Well, let's start with you, Julianne. So you've become one of the world's leading voices on the issue of loneliness and social isolation. How did you first become interested in this topic?
You know, I feel like it's kind of actually somewhat of a boring story.
I doubt that.
But, I wish it could be, some, personal epiphany or something like that. But really, I was doing research focused on psychophysiology and how stress affects our health, and looking at these laboratory-based studies where we would do these stress protocols, and but all of these studies looked at how our relationships impacted that, and so how social support would be associated with blunted cardiovascular reactivity and other physiological markers. But that those who didn't have networks of social support, or individuals who are less supportive, actually showed exaggerated responses. And so it was really looking at how these have such powerful influences on our physiology that really got me interested in the broader health influences that our relationships have. And so this, of course, led me to look at these, this on a kind of a broader scale, but also looking at the protective effects of being more socially connected, and conversely, the risks associated with being isolated or lonely.
And was this research that you were doing as a graduate student, or did it even predate that?
So it started as when I was a grad student. I was doing a lot of these laboratory studies, and some of those laboratory studies even continued into my early days as a young assistant professor as I was getting my research going. But it was kind of that transition that I started really focusing, that transition to really looking primarily at relationships started as from graduate school to entering my career.
Well, it's such an interesting focus, and it's interesting to hear how you came to that, because it's certainly not the most common topic that you think of in psychology. Now, you gave a recent TED Talk that I really enjoyed, and I commend to many people. And you said that lack of social connectedness is as big, or in some cases maybe even a bigger risk factor for premature mortality, heart disease, compared to many of the traditional risk factors like smoking and high blood pressure. How can that be?
Well, there's a couple of ways to answer that question. And one is, what's the evidence to show that? And then the other is what might be going on that leads to those kinds of effects. And so, to answer the first question, we actually have very robust data. We have data that particular study included 148 prospective studies worldwide. We were able to benchmark that relative to the established magnitude of effects that exist that had already been published by other researchers. And when they, you put them toe to toe, really, they do show that they are quite comparable. And in many cases, this exceeds the effects of some of those other factors. And so I guess the second part of that question is, well, how do relationships impact health to have that kind of magnitude? Most of us think of our relationships or lack thereof as perhaps mostly just impacting our emotional well-being. But these have direct responses on our physiology. For instance, if someone is feeling lonely or isolated, that this can trigger a threat response, which in turn signals other areas of our body that need to become more alert, that can increase our heart rate, our blood pressure, inflammation. And so when we experience these things chronically, this can influence a variety of health conditions. And then, of course, the influence on our behavior as well. So we know that our relationships can influence things like our health habits, whether we're getting enough sleep, eating our fruits and vegetables, getting enough exercise, but also reminding us to take our medications, encouraging us to see a doctor, helping with adherence to a medical plan if one already has a chronic disease.
Yeah, and we certainly know that there is a mind-body physiologic connection. When you are angry, when you are under stress, it leads to release of hormones in your body, cortisol, epinephrine, and other things that can over time have positive or negative impact on your health. So I'm a primary care doctor, and a lot of times we talk about risk factors as modifiable or not, and smoking is a modifiable risk factor. You can stop smoking. But what about social connectedness? Some people may feel that, I'm a social person, or I'm a less social person. I have friends, I don't have friends, but there's not as much I can do. That's a little bit out of my control. Is that true?
So first of all, anything that I think has a behavioral component is modifiable. And so we can always modify our behavior, right? And so there is a behavioral component to this, but there's also, a cognitive component, the way we think about our relationships, the way we think about our social environment. Which of course then can potentially also be modifiable. But I think what you're getting at is the extent to which this is personality based, and so one of the questions I get all the time is is it really just introversion versus extroversion, and or is it that introverts like to be alone or prefer to be alone. And so is it perhaps that it's that introverts may not suffer as much from this? First of all, there isn't strong evidence that extroverts or introverts are potentially more or less at risk if they are isolated or lonely. Although there is some evidence to suggest actually that it's introverts that may be at greater risk for isolation and loneliness. But we do have evidence of strategies that can potentially change our risk. And so this absolutely is something that is modifiable. It's challenging to modify, but it absolutely is modifiable, and we can go into more detail if we have time.
Yeah, and actually, I think we're going to be able to talk about that with Lisbeth, because at Scan Health Plan, they are trying to do population level interventions to modify some of these risk factors. But before we get to that, a couple more background questions. What about digital social connectedness? I recently watched that Netflix documentary, The Social Dilemma, about how we're all addicted to our social media applications and get our connectedness through that, and yet that's maybe not the healthiest types of social connections. So where do digital connections fit into this mix?
So I would say that is probably the number one question, and particularly over the past year, is, given that we have had to limit our social contact due to the pandemic, and there's been more and more reliance on digital tools. Uh, this was a pressing question even before the pandemic, and I'd say, been elevated even more so during the pandemic. And it's complex. So I wish I could tell you, it's all good or it's all bad, but the evidence is very complex and quite mixed, because there are a complex set of tools, applications, tech environments, and even within particular applications, there's a variety of ways in which you can use them. And because of this, it creates a very complex literature, but it's clear that there are some limits and potential drawbacks, but there are also some benefits.
Well, it strikes me this is a really important research priority, because we are all spending huge amounts of time on our digital devices. So we need to figure out the health implications of this. And along those lines, there are many different types of social connections that we have. You can have a spouse, siblings, friends, acquaintances, work acquaintances, even pets have some social value. So what do you, at a high level, what do you know about those different types of connections, and which ones are most important to our health?
So they all seem to have some level of importance. And interestingly, there's research to suggest that having a diversity of types of relationships and roles can be more predictive of health outcomes even than the size of one social network. And this makes sense because, as you mentioned, these different kinds of relationships, they can often fulfill different kinds of needs. And so by having relationships with family members as well as friends and coworkers and neighbors, you might be able to fulfill different kinds of needs, or get different kinds of advice, for instance. And so really fostering a variety of types of relationships is going to be important for your health.
All right. Well, that's great background to have. Now, Lisbeth, let's bring you into the conversation. You are the Chief Togetherness Officer at SCAN Health Plan. We're going to talk about that. But first off, how did you become interested in this topic?
Well, this is kind of a long story, so I'll try to keep it brief. But it did start in childhood. I am the first generation born in the U.S. My parents are both from Mexico. And I was always very, very interested in academics and school. And so I always felt, but I always felt like an outsider, no matter where I was. If I was at school, I was an outsider because I wasn't American enough. And at home, I wasn't somehow, I felt like Mexican enough. And so I always felt a little bit of isolation myself. So it's something that stood out to me quite a bit. And then going into the aging services field, I worked with a lot of volunteers, a lot of senior volunteers. And I've noticed that a lot of them had difficulty before the volunteer work really making friendships. And I think a lot of it they chalked up to, being an introvert or personality things, but they were able to make friends in the structured environment of the volunteer work. So that to me was always very interesting. And of course, with the pandemic, I actually supervise a team of about 40 different seniors who are SCAN members, and going home, and that was a bit traumatic for everyone. And so I just worked really hard to make sure that they stayed connected. And in fact, I was so passionate about it that I went back to graduate school so that I could really focus on studying and learning more about social connectedness and what we can do to make a difference in this area.
And what degree did you get in graduate school?
I'm actually still in graduate school. I'm working on a master's of gerontology.
Well, tell us a little bit about SCAN Health Plan. What population does it serve?
So SCAN Health Plan serves people who are Medicare eligible. The majority of our population are seniors over the age of 65, although we do have a population of members that have qualified for Medicare due to disability and under 65. We currently have, I've lost count, but it's over 220,000 members throughout California. So our primary area right now is California, but we are planning to expand outside of California under the leadership of our new CEO, Dr. Sachin Jain, which is very exciting to be able to take the work that we do to many more seniors.
So this topic of social connectedness has been important for the SCAN population for a long time, and to your credit, you've done a lot here. But the new CEO, Sachin, who you mentioned, Dr. Jain, has really made it at the very top of the priority list for SCAN. What was the motivation? What was the thinking behind that?
I think for him, it's just part of who he is, and he's done a lot of work throughout his career. So when he came to SCAN, he did help us to refocus. A lot of the work that we're doing was addressing the issue, but not as directly as we could do. So we would have peer-to-peer interventions, but we were dealing with things like health topics, specific health topics, and kind of skirting around the fact that the members that they were reaching, that our peers were reaching, were reporting feeling lonely, that a lot of the problem was that they just didn't have someone to talk to about everything that was going on in their life that was difficult. So he really helped us to refocus.
And actually, I will just make a quick plug. We had Sachin on the Healthy Skeptic MD about 6 months ago, so that's a good episode if you want to hear, where his motivations for addressing this came from. And I suspect we will probably have him back on at some point. But with under his leadership and your leadership, SCAN started a togetherness initiative. Can you tell us a little bit about that?
Absolutely. So I'm very excited about this work. In fact, I've studied Julianne's work quite a bit in preparation for this program. And we're going to be actually looking at members who've told us already that they are feeling lonely. So we do a health survey each year to a lot of our members, and about 35% of the members who respond indicate that they are lonely. So we're going to be starting a proactive outreach to these folks, and then ask them if they would like a friendly visitor. And for that, we've actually hired several peer advocates. We have senior advocates and peer advocates, which, as I mentioned a bit ago, are members of SCAN that are also paid employees. And so they're going to be reaching out and making calls. I think one of the most exciting things about this for me is that as I've been doing research, I've noticed that the number of programs that you follow some sort of rigor, it's a little hard. I think Julianne would agree that it's a little hard to find programs that are all kind of following the same rigor to measure their outcomes and impact in reducing loneliness or social isolation. And we're going to be using the UCLA 3-item loneliness scale and a very large number of our population. So we're really hoping to have very interesting results from the pre and the post. But besides that, we're actually going to have this friendly visitor. The other part that's really nice is that we are going to be opening up our friendly caller program to all of the SCAN employees. So anyone that would like to have a person that they would call, a member that they would call, they'll be able to volunteer. They'll go through our training. And so we're hoping to have at least 250 just employees throughout the company that are calling members. The other piece of the Togetherness program is that we're going to be really looking at ways to connect our members together. So we have something, we're going to be doing some virtual and in-person type of classes and meetings where we're really going to encourage a lot of interaction between the members. Of course, we'll have to have some rules around that, but I think that we really want to encourage that making of the connection. So we will be using the tools, online tools, social, in a way that we hope is beneficial.
Okay, so Julianne, I'm going to try and get SCAN a free consultation from you on their program. So first, based on what you've heard so far from Lisbeth, are they on the right track, and what advice would you have for them?
Yeah, wow, there's so much to hear, so much rich information. And first off, I just want to, congratulate you on your efforts. What you're doing is very much in line with the recommendations of the recent 2020 National Academy of Science consensus report on social isolation and loneliness in older adults. And for listeners, this report is freely available to the public. And really what this report finds is that there is significant evidence of the health effects, and recommends integrating that into medical and healthcare settings. And so the fact that SCAN is doing that, I commend you for that. And another point that I think is relevant here is in collaboration with my colleague Tim Smith, we recently, just last week, published a meta-analysis of clinical interventions. And what this was is we had 106 randomized controlled trials, and patients who were randomly assigned to receive social support or some kind of psychosocial support in addition to standard medical treatment were 20% more likely to survive. And among those that looked at survival time, 29% more likely to have to survive longer. And so what this evidence suggests is that these efforts may potentially not only influence loneliness levels, but might actually improve clinical outcomes, including actual survival.
And can I just ask, was that a randomized trial, or what was the study design there?
So it was a meta-analysis of randomized controlled trials. So 106 randomized controlled trials, total with over 40,000 patients. And so those interventions, though, varied, and varied in their strength too. And so that's one of the things that I would, I also am excited to hear is that you're testing what you're doing, because there is a lot of variability. Some were much more effective than others. That testing what you're doing to make sure that it's effective is going to be really important.
I think that's wonderful advice. I'm sorry, I just wanted to interject and say definitely that with the peer advocates, the peer-to-peer intervention is we're really hoping to make that experience more customizable for each individual's need. And the peers are also trained on motivational interviewing techniques, and so they can really kind of help the member understand or get to those causes and what might motivate them, hopefully, to make some changes. So for someone, if it's a matter of just not knowing like what resources are available or what types of social activities are available in their area, that they can, during the process of their friendly visits, which will be a 6-month program, that they'll be able to connect them and help them be embedded in the community.
Well, and that peer-to-peer support, as well as I think you mentioned that there may be either volunteers or hired staff that also provide support. One of the things that's really interesting is some research suggests that the person providing the support can often benefit just as much, if not more, than the person receiving the support. And so engaging people in a way that is that peer support where they're helping other people can also be really beneficial.
That's an important point. So it definitely can go both ways. One thing you said that caught my attention, Julianne, is that in the meta-analysis, some types of interventions worked and others didn't. One of the things we try to do in the Healthy Skeptic MD is really distill and dig into the evidence and try to do what's evidence-based. Any sort of themes that emerge that might be relevant to SCAN or other organizations implementing interventions?
That's a great question. And there were a variety of types of interventions. So, and which I think, some were peer support groups. Others were hired personnel that delivered the support. In other cases, it was training family members or caregivers to help engage in that support. So there were a variety of different types, but interestingly, there was still variability among those. And so, one possibility of why there might have been variability is that in these randomized controlled trials, they didn't assess people's existing levels of social connection. And so the work that you're doing is particularly targeting individuals who have already self-identified as lonely. It's possible that those effects might differ depending on how high risk someone is.
Well, I think it's really important. You mentioned a 29% overall improvement in health outcomes from these interventions. If this was a pharmaceutical, a drug, a medical device, we'd be hearing a lot about it, and we'd be working really hard to understand the right way to use it to achieve those benefits. And gosh, it just seems that we should be devoting that same type of focus to figuring out what works, with loneliness interventions and social connectedness interventions.
Well, I do think that at SCAN, that is exactly what we're trying to do, is that we see it as it's a health issue that needs to be addressed. I mean, the information that Julianne just provided about the percentage, I mean, that's very substantial, and we want to treat it as a health issue. So that's how we're looking at it. We're definitely looking at the impact on overall health that these interventions to reduce loneliness and social isolation can have. So we're putting a lot of importance on it and seeing it that way for sure.
So that actually gets at the next topic, which I wanted to ask you about, which is policy interventions. What could be done at state, local, federal levels to advance efforts from people who want to improve the social connectedness of their population, their community, or whatever it may be?
Well, I will jump in first, only because I know Julianne knows a lot more about this. But I would say generally, I think that if you look at the amount of funding that the Older Americans Act has had between 2011 and 2019, it's been pretty much stagnant. It's been flat, and it wasn't until 2020, because of the pandemic, that they had an increase. During that same time frame, you had a drastic increase in the number of seniors. So I think that I would recommend that the current level of funding due to the pandemic for Older Americans Act to be maintained, and because that has helped a lot of organizations proactively go out and look for seniors that are socially isolated and connect. So these people were already lonely and isolated, but I think because of the pandemic, people realized that we needed to go out and look for them. So I think that level of funding is one idea. And then I also think that CMS needs to maybe look at this as a potential STAR measure. So just like they look at urinary incontinence or the other things, they should look at things like social isolation and loneliness as a measure that health plans and doctors have to be mindful of and strive for that 5 stars.
So I'll speak quite broadly, and I'll relate this to also the pandemic. And that is that, during the pandemic, because we had to reduce social contact in order to reduce the spread of the virus, we all saw dramatic changes to every single aspect of our life. I mean, it influenced how we work. It influenced our entertainment, schools, education. It pretty much touched almost every sector. And I bring this up because what I propose is that we think of the World Health Organization's framework of health in all policy. And what I argue is that we need to take a similar kind of framework of social in all policy. And we can see how there is relevance, social relevance, across transportation, housing, health, education, all of these sectors can potentially have policy that either fosters social connection or limits social connection.
I really do like the idea of healthcare organizations creating metrics to really get at that, the CMS STAR metrics and so forth. And Julianne, what you're saying, these are really population-wide efforts, and we need to think about how to structure things at a policy level to make it easier for people to stay socially connected. So we really need to come at it from different angles. What about at a big picture level? Are we moving in the right direction? Is our society as a whole becoming more or less socially connected?
I think it depends on who you ask. No, I think my opinion is that we were moving in probably a bad direction. I think one of the consequences of the pandemic is that more people are aware that this was how pervasive the problem was, and just how many people in our society suffer from loneliness. And so I think there's a lot of talk from people right now. It's mostly talk about making a change. So I think that's an indicator that it's in the positive direction. But I still think that there's a lot more as a society, the federal government, state governments can do to really encourage the connection. And I think a little bit about a book that was recommended to me by Dr. Sachin Jain, by Dr. Sachin, for the Bowling Alone and the Undoing of the Fabric of America. And I do think that we can reweave that fabric, but I think we have to be a lot more inclusive than we've been in the past. I think now we have to think more about the diversity of our nation and make sure that everybody feels included. So high level, yes.
From a scientific standpoint, it's also difficult to answer because unfortunately, there's no one standardized approach to measure this, and it certainly hasn't been systematically assessed at a population level over time. And so we have lots of national surveys, but they don't always necessarily use the same survey, or they use different classification kind of thresholds to classify people as lonely or not lonely. And so that makes it challenging to say definitively, like, yes, it has increased, or no, it hasn't. And so there's certainly evidence to suggest that it has been on the rise, but there is also evidence to suggest that it's been relatively stable. And so, but one of the things that I think is clear is that there is a significant portion of the population that is isolated, lonely, or both. And given the health effects, we cannot ignore it, as well as the need for really establishing that, so that as efforts are being done, whether it's what SCAN is doing to national policy, if we have standardized population measurement, we can see as a population, are we improving as a result of these policies, as a result of these programs?
And I'll just say at a personal anecdotal level, I'm a primary care doctor, and gosh, during this last year and a half during this pandemic, I have never seen more instances, sadly, of older people struggling with loneliness, that they are actually bringing those concerns to me as one of their top one or two health issues in many cases. And I've seen the mental health manifestations. I've seen flares of bipolar disorder and depression and anxiety disorders, which really seem to be very closely connected with the isolation from the pandemic. Now, hopefully that's going to change as the world starts opening up, but it really brought home for me how important this is to address at a big picture level beyond the pandemic. And that's actually where I'd like to close on an individual level today. Many of my listeners are lay public individuals and patients. And, what advice would you give to someone of any age who's worried a bit about being lonely? They feel they don't have as much social connectedness as they would like. How can they address that? Maybe Lisbeth, we can start with you.
Absolutely. So I think that first of all, they should talk to their doctor. Working with older adults, I know that a lot of them hold back a lot of information from their primary care doctor about how they're feeling, how they're managing their emotions, and it affects their health. So I think that talking to the doctor is something that's going to be really important. I also recommend that for those that are able to get out or that want to volunteer, to look for volunteer opportunities, and actually becoming a friendly caller, making sure that you yourself do a proactive outreach to someone in your life that may need a contact, I think is a great way to help yourself, help to connect with somebody else, and also help the other person that you're reaching out to. So I think it's important that people just pick up the phone and call each other. Even if you feel like I haven't talked to that person in a while, I think that's a perfect reason to pick up the phone and call.
And I'll just add to what Lisbeth already mentioned, because I think each of those are excellent recommendations. Absolutely talk to your doctor or other healthcare providers, because this is a health issue, as well as looking for formalized opportunities. But from a more informal approach that literally anyone can do, I did a study over the summer where we found that individuals who did small acts of kindness for their neighbors over the course of 4 weeks showed significant reductions in loneliness. Something as simple as talking to your neighbors can potentially reduce your loneliness. And so, as I mentioned earlier, one of the most powerful ways that you can, by helping others, you can help yourself. And so, looking for others who may need a friend, who may need help, can not only spread kindness and help others, but will help yourself in return.
That's a great sentiment. And, actually, that's something I recommend to my patients is to participate in charity or community service. It's a great way to give back and get the social benefits of being more engaged in the world around you. Well, I want to thank you both so much for joining me today. This is, social connectedness is such an important yet under-focused on topic. So, the work you're doing is so important. Lisbeth, Briones-Roberts, and Julianne Holt-Lunstad, thank you for joining me today. Thank you to SCAN for supporting our episode today. If you enjoyed the Healthy Skeptic MD podcast, please search and subscribe wherever you listen. Pass it along to friends or family who might be interested, and leave it a review if you have a chance. We'll pick it up again in 2 weeks. Thanks for joining.